So Rob, maybe I'll come to you with this part of the question. You know, some of the trends we've been seeing are in market scan data or other things like that. Tell us a little bit about what you think about how we can better support the decision making around dosing.
I look at something like atrial fib and decision support and say, why should it be any different if you're in Rochester, Minnesota, or San Francisco, or Illinois, or Ohio? It's the same questions, the risk factors are the same, the doses have been worked out in clinical trials. You know, maybe it should be available to the public in a way that if I went to you as a doctor and you said, I'm going to put you on 2.5 of apixaban, and the decision support said that's wrong, you would have some way of addressing that problem other than, you know, trying to find another doctor, which for most people is just way beyond what they could possibly muster the know-how and energy to do. We make it very hard for that to happen. So I think as we look at the data, we now live in an environment where we can stomp out bad variation. And then the job of a good clinician becomes to say, there is a standard, but I can find the exceptions to the standard that deal with the individual people, and I can talk with people about what they're thinking.
Rob, I totally agree, but I think we're getting there. One of the problems that I have found with shared decision making using support systems is they're incredibly time consuming, and we have an ongoing grant that a colleague of mine has at Mayo right now looking at this. And it's the right thing to do. It's very time consuming. And so I think if we're going to have shared decision making, and I couldn't agree more that we should use decision support systems, then the administrators and payers are going to have to provide the staff to do that.
But I think you're thinking about it in an old-fashioned way, with all due respect. I mean, the idea that all of the discussion about decision support should happen in a doctor's office just seems crazy. I mean, if you want to go out and eat Italian food, you call it up on your cell phone, you get a list of the restaurants, you get the reviews, you see where it is, you get a lot of information about it. Why shouldn't a person be really prepared when they come to the doctor's office with all that stuff and then save the human discussion for what's really important?
I think that, I mean, I guess you're right. And, I'm sorry, Bernard, were you?
What I was going to say, I think, Rob, it's great that you're doing this, because right now, if you want to get funded for shared decision making with decision support systems, and you want the NHLBI to fund that, it's all in the doctor's office. And I agree that's not a practical way to go in the future.
I think the word I would say
to convince them.
Yeah, and I think the word I would say to your question, first, I agree with the term clinician. Don't get me wrong, I think it is an important one. And now we're going to get to the good stuff of how we help our clinicians through what the questions are. Number two, I think, Rob, there's a word that we should use for both sides of the equation, and that word is trust. So patients still come to my office because they trust the doctors and the clinicians, and they may be trusting them less and less, and we need to work on making sure they're empowered with information. But misinformation or bad information exists in lots of places, one of which is certainly the internet. And so I would suggest that I think you're right. What we have to do is figure out a way, and I know you're tackling this, is of saying, how do we get truth or at least peer-reviewed information in a way that can be understandable to people? Let's take the AFib patient who comes in who's getting the wrong dose and make sure they understand that this isn't very complicated. And then they can have the conversation with their doctor about why that dose is being chosen. Is it because I'm older? Is it because I have renal dysfunction? Is it because I've fallen? Are those the conversations you could have? And I think we are empowered. We should be working to make sure our colleagues don't just go with what I'll say is the reflective action.
I agree with what you said. I think there's one other point that needs to be added. Those people who trust you when they come to your office are only the people who manage somehow to make it to your office.
Right, sure.
And for every one of those, there are dozens out there who are not making it to any competent office right now. May have to drive 2 hours for a visit. They wait in the waiting room, they get 15 minutes.
Yeah.
They're out of there, and I can tell you they're searching Google as soon as they leave the office on whatever cell phone they have, trying to figure out what the hell you were talking about because there's not enough time to remember it. So I certainly don't pretend that what's on the internet is great information, and we all need to work on it.
Yeah, so maybe...
And let me just make one other point that Sean talked about earlier. We talk about underdosing, but remember the worst dose is 0 milligrams.
Yeah, that's right.
And almost half our patients are on 0 milligrams. So, but that's also a responsibility. And Rob, you were helpful with this trial that Sean actually really led, which was going to patients through kind of a large, the Sentinel data set, and going out to patients who had diagnoses of atrial fibrillation, had not been on an anticoagulant for the last year, and basically telling the patient, it looks to us as though your clinician has not kind of succeeded in doing a good job in addressing your health concerns. So going to the patient, and we'll see, Sean, what kind of effect that has, but we're hoping that maybe will move the needle some.
Yeah, I think, Rob, this is your point. I think patients need to really be the agent of change. I think they need to be educated, and they need to be able to engage in their own health decisions. And I think that providing decision support and help through Google and providing valid resources that can help them accomplish that is really critical.